So Dr. James Skinvosky is an innovator doctor, a robotic surgeon spreading high-tech surgery to the world. He is the president of HTC High-Tech Surgery Association, which has 10,000 members in 108 countries worldwide. And he's the CEO of HTC Company for the improvement of life. Dr. Skinovsky has been working with health tech for around 20 years, leading an association specializing in high technology applied to medical science. Dr. Skinovsky was one of the first surgeons in the world to develop a single port surgery platform back in 2006, performing the first multicenter study dedicated to that approach, which is mentioned in the Surgical Innovation Journal. Professor Skinovsky is now involved with new robotic platforms, use of virtual reality and remote medicine. Dr. James, I will now try to give you the access. Maybe you can, if you are able to share your screen or start the video. Perfect.
I'd like to thank you all so much for the invitation. It's a great pleasure and an honor to be here with the audience. And I have the pleasure to share with you some minutes when I'm going to talk about this exciting subject, which is the on the way of robots in the surgical practice, where we are and to where we are heading to. So let's start. Is it okay? Is everything okay?
Perfect. Yes, yes.
Okay. Thank you so much. Sorry for the inconvenience. So let's go on. My dear friends, with the appearance of the endoscopic surgery or the so-called minimally invasive surgery around 30 years ago, several new technologies and new approaches came to the surface, as the single port surgery, mini laparoscopy, the nodes, the surgery by natural orifices, and the augmented reality, virtual reality, for sure, you've already had contact today. And also the robotic surgery and the upcoming nanosurgery. All of them are seeking to catch the art of invisibility. So enter in the body to do the job and to cause the less physiological and immunological consequences to our patients. The term robot was quoted for the first time for Josef Capek in 1921 from the Czech robota, which means labor. So robots are machines that can be programmed to perform a specified set of simple or complex tasks with or even without the human assistance. We have some landmarks in this history related to the surgery, which are in 1985, the first so-called robot was used in the patients, whose name was Puma, and it was used for brain biopsies. 1992, it was released the RoboDoc, which was a robotic arm used especially in orthopedic surgery. Sorry. 1994, the Computer Motion, a company, released the ISOP, which was endorsed by DARPA. DARPA is a military program from the United States, and it had an optics, voice control, and the condition to control the operation room, whose name was Hermes. 1998 was released the Zeus by the same company, which had 3 independent arms adapted to the first one, the ISOP, which was composed by the optics control. 2001, an interesting and quite powerful landmark, the Operation Lindbergh, which was a remote surgery, the first one. It was a cholecystectomy performed by Professor Jacques Marescot. which was in New York, and the patient in France, in Strasbourg. This is the beginning of the remote surgery, which is coming very fast for us. In the upper corner, we have the ISOP, the first one, the robotic arm, and the ZEUS, which was a continuum of the ISOP. 1995 was founded the Intuitive Surgical, the biggest, this is still the biggest company when we are talking about robotic surgery in the world from the United States. They released their first prototype, the Lenny, in 1995. In 1997, the Mona, which was used for human trials. And finally, in 1998, they released the famous Da Vinci, which was approved by the FDA in 2000. 2003, we had the fusion of the computer motion and intuitive surgical in the same company. So the main advances from the Da Vinci era are it is composed by three main components: the patient card, the surgeon console, and the image system. And they released some advances according to the following years. In 2002, the Da Vinci was released with 4 arms. 2006, the Da Vinci S with 3D HD camera vision. 2009, the Da Vinci SI with improvements in terms of image and single port access. We are going to see it. And finally, in 2014, the Da Vinci XI with improvements in terms of flexibility, in terms of movements and vision, especially. This is the Da Vinci. It still is the most spreaded robotic platform in the world, as we already saw. It is composed by 3 components, and one of the problems is, we are going to see in the next slides, that is the surgeon console is too isolated from the operation room itself. The communication between the surgeon and the surgical staff has to be made by a microphone, so it's not interactive with the operation room itself. This is the console, the main console, with 4 arms. It's too big. This is me in the surgeon console, so we can control most of the actions using the feet, so coagulation, the movement of the robotic arms, and the optics. This is a more closer approach, and this is the vision when you are approaching the console of the surgeon. So in 2017, we already had the Da Vinci in 2,800 American hospitals and practically 3,500 worldwide. 3 years later, 2 years ago from now, in 2020, we already had 5,700 Da Vinci units worldwide. So we are facing a huge increase in the robotic surgery around the world, especially if the releasing we are going to see of the new platforms that are entering now in the market, because the patents of the Da Vinci already expired. So as I've talked, we are facing an invasion, world invasion of new and maybe better robotic units and platforms around the world. Around in 2020, 5 million surgeries already were performed with the platform. The advantage, 3D vision, visual magnification, high precision because of the tremor suppression, a better ergonomy, the possibility to do remote surgeries, the possibility, which is increasing each time more and more, the AI, the artificial intelligence integrated in the platform, image guiding, and so on. But it has some troubles, as it's too expensive. It's around $2 million. It's big size, so it demands a dedicated operation room. It is difficult to move. The limited ability to switch instruments, it takes time, and it lacks haptic feedback. Haptic feedback is the condition that you can feel the contact with the tissue. So if you are going to do a suture in the stomach, that as an example, is different. You feel different if you are going to do the suture in the bowel, as an example. So it's an important skill that is not present in the Da Vinci Act. The new platforms that are coming have the main goals as to reduce its costs, to reduce the size. So the trend is the miniaturization, and the condition to do the LAS, which is the single port surgery, and surgery by natural orifices, that we are going to talk a little bit about it with the advance of our talk. To allow more flexible movements, the condition to have the haptic feedback, biometric integration, so the use of eye tracking cameras, head tracking, where you can control the optics with the movement of your eyes, of your head, which is more integrative. The integration between the medicine, the surgery, and the computer techniques, the AI, the magnification of images, the augmented reality, reproduction in the very closer future, the reproduction of surgical step by self-learning with the robot, and finally the remote surgery and the possibility still to do the space surgery. So we have a lot of new platforms arriving. Most of them are already in the marketing, and I'm going to pass by the main ones. One of them are from the transenteric company, the Ascensus, which is a multi-port robotic platform. And the main advantages are that this platform has the haptic feedback and the camera control by eye movement. So this is a trend, and the surgeons are not going to stay so isolated from the patient and from the surgical staff. But it is still expensive, and it still has a large size, as you can see in this picture. A small video just to clarify about what are you talking. You can see that you can control the optics just with a glass, just with the eye or head movements. The console of the surgery are more free, so you can interact with the operation room itself and the staff, and you are more integrated with the environment of the operation room. Let's go on, because we have a small few time. Another one is the Versus robot from UK. It's cheaper when compared to the first one's platform that we've talked about it, and it's very important to be small, lightweight, and portable. This is the Versus. So we have, this is another trend. we have independent arms, so you can set our platform according to your needs. If you have not a so big surgery, you can assemble 1, 2, 3 arms according with what do you need. And you can move one by one. So it's not so big and it's easy to move. This is the platform. I'm going to advance a little bit so you can move. It's more flexible, it's light, and brings to you a condition to work in a better environment. You can switch the instruments in a more easy way, and to control the optics with the use of a special glass or even a headset. These platforms is already in several countries, in several operation rooms in the world, and it's quite easy. You can see the difference between this one and the still most used one, the Da Vinci. Another one, a big company, Johnson & Johnson, are releasing by now, especially in the beginning of the next year, with the partnership of Google, its own platform, the Ottava. It's we have some difference, but not so much. The platform is integrated into the operation table, and it consists of until 6 arms, as you can see here. We don't know yet about the price of the releasing. Another big company, the Medtronic, is already by now releasing its own platform, the Hugo, and it has very interesting features as the modularity, so we can compose our own platform. We can buy the pieces of the platform step by step. So if you need 2 arms, you are going and buy 2 arms for the first, and maybe later we are composing the rest of the platform. So it's cheaper to assemble, to set. And another feature quite important is we can use hybrid instrument with laparoscopy. So you can use, it's not necessary to have a special instrument, robotic instrument for it. So you can use in the platform regular laparoscopic instruments, regular laparoscopic image set, and even the optics. So the price is quite lower, and it's very interesting. And this is the trend. Let's see here. This is the parts of these are the parts of Hugo, and it's quite interesting because, as I've told, we can use what do you need exactly. Another one is the Miro robot, and it is the smallest multi-port robotic surgery system. So you have here another trend, which is the miniaturization of the platforms, facing in the future the use of bolts. This is the platform. It is entering in the market by now. So as we can observe, we are passing by now in a new revolution in terms of the robotic procedure and its integration with the augmented reality and the use of the nanotechnology. Another one is the BiTrack from Spain. It is quite similar from the previous ones, but with the smaller size and with an estimated low cost. It is still not in the market. It's going to enter in the market next year. We have another one, Revo, which is quite similar to VINCI with the same limitations, but it has haptic feedback, but it's still too big. This is another one quite interesting from India, the Mantra, and it's very, it's similar to the Virtual, so you can use individual arms according to what you need in your service, in your surgeries. So another one is the from transenterics, and the differences are that in the platform, the tools are attached by magnets, so it's easier to change it. It has an eye tracking system with infrared. When you move your eyes, we are going to get the movement of the optics. So it's quite practical in your daily. This is the platform. So let's talk about, during some minutes, about the single port surgery. Single port, as we can see in the name, is the procedure that you can perform surgeries by one single incision, okay? I'm not going to enter in details because we have the time, but the main aims are to improve cosmesis and to decrease post-operative herniations, and so on. We've started, I was one of the first in the world to work with this kind of procedures. We've started in 2006, but the problem with the single port surgery is the collision, the internal and external collision of the instrument. So you have a lack of triangulations. So in order at least to decrease it, we've and the market releasing a series of articulated or even flexible or curved instruments, as you can see here. I've worked with the first platform commercially available in the world, the single trocar access, but just right after it, a lot of companies around the world released their own single port platforms and instruments, as you can see here. We had a lot of publications about it, and the single port with the robotic platforms found its home, as you can see here. So you have conditions to do the single port surgery in the robotic platforms, as you can see here. We have a dedicated platform for the VINCI, especially for single port surgery, as you can see here. Imagine you can enter by a single incision, a small one, with 1.5 centimeters, 2 centimeters, with the platform, and you can perform surgeries leaving the body with almost without any changing in terms of physiopathologic troubles for the recovery of the human body. Quite interesting, huh? We have another platform that's just going to name it. Another one for a single port surgery is the Sport. This is from Titan company. It's a small one, and it's already dedicated, completely dedicated for the single port surgery, and it's similar to the platform, to the concept of the Da Vinci in terms of single port surgery, or we can talk about it, the last laparoscopic single site surgery. Is it the same concept and name? This is the platform from Titan. I'm just going to find here. It is not still in the market, but probably they are going to release it in 2023. It's very light and it is very interesting. Let me run a little bit here. So it's very interesting too. Another one, still in the single port surgery, is the spider from Transenteric, and it has a single arm mobile cart with 3D HD vision. The concepts are quite similar than the last ones. This is another one from the Virtual Incision Company. It's different because it is composed just for a single arm that you can set, you can assemble in the operation table and perform your surgery with an optic system and two robotic arms, and the surgeon stays in the specified console. It's very interesting too. Thus, it's just to quote, this is one for single port surgery, just dedicated for transvaginal procedures. This is my favorite. It's very interesting. This is the vicarious are in they are putting already in the world market, and this small pet, as we can talk, just imitate the movements, the outside movements of the surgeon, as we are going to see in some parts of the video. As you can see here, is completely flexible. You can put it inside the abdominal cavity and to do a vast series of type of surgeries with the minimal invasion of the body. You can see here the surgeon just moves, and the small robot, as you can talk, just imitate the movements of the surgeon. We are going to face in the next years the use of artificial intelligence in this robot. So they are going to do in the next years, maybe the next decade, some steps by day on, and the surgeons are going to perform just the main steps of the surgery. The surgeons are going to receive a lot of warnings about the need to take care about some anatomical elements, the risks, and so on. This is the present and the future of the surgery. Some words about the endoscopic robotic platforms. We can talk about, when we are going to talk about endoscopic procedures, we can use the word nodes, the natural orifices, trend endoscopic surgery. So the surgery by natural orifices. It started by a transoral cholecystectomy in 2007 by Professor Jacques Marescot. This is a figure from my dear friend, Professor Ricardo Zorron, which is working in Germany by now. It's a transcolonic hepatosigmoidectomy. And we are using this kind of approaches, especially for transoral or transanal procedures. So we have some platforms to perform robotic colonoscopy with the performing of procedures, and also from the oral approach, as you can see here, partially or totally robotized. This is the one extremely interesting platform. So you can enter as an example by the oral approach, and to perform biopsies, even in the future to surgeries for GERD, for the reflux, and a lot of procedures, of course, without any exterior scar in the body. Okay, another one, Japanese one, which is quite interesting for this kind of node surgery. This is another one to perform colonoscopy and even endoscopic surgery. We have already robotic platforms for microsurgery, as you can see here, with 3 millimeters instruments. So we are seeing here in this very fast talk that we have really a revolution happening by now in the world in terms of robotic and the use of artificial intelligent surgery. So this is the fantastic voyage, a move from the 70s, 60s, by the end of the 60s, and we are facing now, we are seeing the reality following the fiction, as we can see here. This movie showed a spaceship, as you can see, traveling inside the human body, as we are almost in this stage, as we are going to see in this next and last slide. So we already have robotic capsules. This is already in the market, and the technology is increasing very fast. And we already have the capacity, but in the next years, it's going to improve. We can control the capsule. We are going to have the ability to move and to perform biopsies, to use the cauterization in the digestive bleedings, and so on. Just with this small, we can talk about the ships. So the miniaturized endoscopes has the main feature. They are going to be used for diagnostic, to target drug delivery, and to the surgical applications. Just to clarify, when we are talking about millivolts, we are talking about a millimeter scale robots, and it has to be the free movement inside the body and the millimeter scale. We have another name, the micro bolts, which is any synthetic construct with self-contained functionality at sub-millimeter scale. So they are robots with less than 1 millimeters, and they are going to be available for us in the upcoming years. It has 4 key characteristics: the containing propulsion, so they are going to move by itself by electromagnetic fields, ultrasonographic energy, chemical reaction, superconducting technology, and so on. They have miniaturized functionalities, accurate telemanipulation, and it's going to have a consistent visualization, as you can see here. We already have in prototypes the microbolts, the nanotechnology for us. It's an quite interesting initial prototypes, which use the heat, the chemical reactions, the ultrasonic energy, and so on, to gain movement, and it has they have less than 1 millimeters. Imagine what this kind of technology, this kind of millivolts are going to perform inside the human body. Is fantastic, and it's not a fiction, it's already a reality. We can even in the future to manipulate our DNA and quite small microsurgeries. Well, my friends, I'd like to thank you so much for the patience, for the invitation. It was a great honor. And for me, I'd like to invite you all to participate of our HTC High Tech Surgery Association. We have an website, and we are already in the Facebook. Thank you so much. Thank you for your time.
Thank you so much, Dr. James. Unfortunately, we are not left with time for questions, but any questions that come from the audience, I will email them to you if that's all right.
Okay, thank you so much. I'm so sorry for the time, and it was a great pleasure for me. Thank you so much.
It was wonderful listening to you, Dr. James. That is why I didn't want to stop you. Thank you so much. Thank you so much for taking the time.